I'm Dr. Brian McDonough. This past Thursday, I was tested for COVID-19, and I want to share this story. I normally don't talk about personal stories, but sometimes it's important for all of us to learn from this. I have had the antibody test in the past several times because I treat patients who have COVID, and I've always tested negative. This past week, I had a face-to-face encounter with a patient. It was a prolonged encounter. I was wearing PPE. The patient was wearing a mask. But because of the length of time and the fact that I started to develop symptoms of chest tightness and kind of difficulty breathing, it concerned me that I could be at risk for COVID. Now, we know the symptoms of COVID, again, we'll go over them: a fever, cough, shortness of breath, chills, muscle aches. You might have a loss of the sense of smell or taste. Vomiting and diarrhea are two of the newer ones. And when it gets more serious, you worry about chest tightness, worry about difficulty breathing, even worry about disorientation, and it can get worse. So I thought, I am in a risk category. Didn't have a fever, but I still had those secondary symptoms. So the first thing I did, wearing a mask, making sure I took precautions, and having the tech who was doing the EKG wear a mask and take precautions, is I got an EKG, because you want to make sure if you're having a heart attack, you get to that right away. The EKG was normal. That led me to the next step, which was to get the COVID test. Now, this isn't the antibody test. This is the one where they go in and they get nasal swabs from each nostril and they go all the way up. Had that test performed. I'm happy to report that test was negative. So I found out I did not have COVID, but I still had this chest tightness. Now, just to tell you about the power of positive thinking, it seemed as if the chest tightness wasn't nearly as bad now that I had a normal EKG and tested negative for COVID, which tells you how you can work yourself up. But I also then went for a stress test. The stress test is the follow-up, even with a normal EKG, if you have concerns. Now remember, and this is important, I went for the stress test after the negative COVID, because if I'm going to be in a test setting, even wearing a mask, you don't want to put other people at risk. That test turned out fine. I'm sharing the personal story, though, for two major reasons. The first is, if you have symptoms of COVID, it's important for you, your family, your loved ones, and others to get tested, get yourself out of circulation. Because in that case, I was a patient. I wasn't a doctor. I was someone who could put others at risk. The second thing is, don't forget about common things occurring commonly. Before COVID, chest pain would have been associated with a heart attack. And that was a primary concern. Could I be having a heart attack? Fortunately, I wasn't. Fortunately, I wasn't COVID positive. But as you know, things could have gone the other way. And that's the important point. Don't deny your own health, whether you're a doctor, whether you're a patient. If you're watching this, just kind of keep it in mind. It's the only reason I'm sharing a personal story, not for drama, but for the reality that all of us have to take our health seriously and we have to worry about others.